The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hey everybody, welcome to another episode of APIC's The 5-Second Rule. I'm Silvia Quevedo, Director of Practice Guidance, and we are coming at you yet again from the global pandemic, COVID-19. We have a lot to talk about today. Today's episode is going to be about advocacy. And I know that's not always the sexiest term out there, but it is crucial. It's critical, especially at this time. So we have an amazing guest. Her name is Sarah Smathers. She is the System Director of Infection Prevention and Control at the Children's Hospital of Philadelphia. She's the immediate past president of the Delaware Valley, Philadelphia chapter of the Association for Professionals in Infection Control and Epidemiology. That's us, APIC. And she's currently the chair of our APIC Public Policy Committee, and she serves as the adjunct professor at Drexel University's Dornsife School of Public Health. Sarah, welcome to the 5-Second Rule.
Thank you, Sylvia. Thank you for having me.
So, Sarah, advocacy, so important. I'm going to share a definition I have here, just in case anyone out there is going, oh my God, what is this advocacy business? According to a definition, it is the public support for or the recommendation of a particular cause or policy. So it's really all about someone going out there and trying to get support for a policy that impacts their work, their life, their situation. What do you think about that definition, Sarah?
I love that definition because one of the things that I think about when infection preventionists ask me, what do you do with advocacy? That sounds so hard. How do I get involved? Is really reminding them that they do it all the time. And so it's part of our everyday practice. We're constantly writing policies for our organization and pushing for, what's best for our patients, what's best for our employees at our organizations. And so I really think that infection preventionists are awesome at doing advocacy because we do it all the time in our everyday work.
Yeah, so it shouldn't be a huge stretch for the infection preventionists out there to get involved with specific policies and recommendations that impact their work across their state and across the country.
I think that people are, what they need is to know when these policies are happening, and so that they know that they can jump in and get involved.
So I want to share some data points, and in 2019, we had approximately, at APIC, over 8,600 letters that went to members of Congress and state legislators. And those 8,600 letters were written or sent by about 1,600 APIC members, which, by the way, folks, represents approximately 10% of our membership. So here's the issue. Here's the problem. I think about it when there's a fire and everyone expects someone else to dial 911, or, hey, we're in an election year, people say, well, I'm not going to vote because other people are going to vote. So would you say that's the same issue with advocacy and getting engaged, Sarah?
I think it's a great analogy, and I think that, APIC does a great job of sending out resources. They are sending out things that are important to our members in the action alerts, and these are things that you can sign up for. They come to your email, and they're so easy to click on it. I would say they probably take less than 30 seconds to really click on it. It can, auto-populate who your representatives are if you don't know who those people are, and send them a letter. But what happens then if we have all 16,000 members behind us sending those letters out, then it's reaching our representatives and letting them know this is important. So if only one or two people are sending it, that's not going to bubble up to their attention. But if we have the full force of our membership behind it, they're really going to be able to see that as an important part of our practice.
So we're going to come back to all the great tools that APIC has put in place, but maybe to help our infection preventionists understand what are the key issues. And by the way, if you're not an infection preventionist, remember, infection prevention is everybody's business. So if you're listening and you're going, well, this doesn't apply to me, it does, because a lot of what our members are advocating for involves creating a safer world. So, Sarah, maybe talk us through some of the key advocacy, policy, regulatory issues that we are trying to address with our legislators, our members of Congress. Can you walk us through some of the key topics going on right now?
Absolutely. So certification is really top of mind for me, and it is something that I require of all of our infection preventionists at the Children's Hospital of Philadelphia. And I know that a lot of other health facilities do, require or encourage their infection preventionists to get certified. And what we want to do with the Public Policy Committee is really support APIC in continuing to work with our legislators, our stakeholders, to make sure that infection preventionists who are working in hospitals are certified within 3 years. We do know that there are some states out there with some type of certification requirement, and that I think those are Colorado, New Jersey, and Nevada. But not all states have a certification requirement. We've noticed lately, I think a lot of infection preventionists will notice that there have been certification requirements for like sterile processing technicians with some of the outbreaks that have happened with endoscopes. And so people have become really vocal about wanting to make sure that those folks are properly certified. So it's the same with infection preventionists. If we're doing the work in our hospitals to make sure that we're preventing hospital-acquired infections properly, that we're addressing outbreaks properly, then we really want those people to share a common curriculum and a common education. And what's different for infection prevention and control is we come from many different backgrounds, which is a great strength of our discipline, but it also means that there isn't the same curriculum in the schools. What a nursing gets in infection prevention is different than a microbiologist or a public health person, and there's certainly many other disciplines that come into our field as well. So certification is a way to really level that playing field and show that we've all had those basic competencies to perform our role.
Yeah, I mean, certification in any profession tells the public that the person has gone the extra mile to ensure they have the necessary requisite skills and knowledge. I mean, frankly, I don't want to drive across a bridge from an engineer that has not been properly educated and is not certified. So I think the same is true for an infection preventionist. So certification is a big one, and that would be something that, Sarah, what would you want your colleagues across the country to do about ensuring that certification is a requirement beyond this? What did we say? Colorado, New Jersey, and Nevada currently have that requirement. But Sarah, what would you want your colleagues around the country to know or do about this issue of certification?
So my advice to infection prevention is that if you live in a state that does not have certification, but you know that it's something that lawmakers are interested in and that they're talking about, then I would really encourage you to talk to your state representatives. And so find out who those people are, write them letters. Right now, we're in the midst of a pandemic, so you're probably not going to be able to arrange a visit to them, but potentially if they're doing virtual visits, that's something you could do. You can call them and really show your support and explain why it's important. So something that we don't always realize is that as infection preventionists, we are the experts in our field, and when people are making laws for us, they don't really understand the work that we do. So we really need to reach out to them and let them know and understand why this is important to us and why we should support it.
Great. And oh, by the way, if you're listening and you go, yeah, but I don't know who that guy is or that woman is in my state, APIC makes it really easy. All you need to do is contact us at legislation@apic.org, and we can get that information out to you. So, Sarah, there's certification. We're in the middle of a global pandemic. We have COVID-19. I mean, the time is now to really be in front of our lawmakers, in front of our regulatory bodies. Talk to us a little bit about some of the efforts the APIC Public Policy Committee has undertaken to address COVID-19 and some of the challenges during the pandemic.
Yes, there's never a better time to really talk about what an infection prevention does than in an epidemic or a pandemic. And so one of the things that we were discussing early on with the Public Policy Committee was whether or not we were going to be able to do our typical lobby days, and what we aren't, because we aren't able to do our visits in person. But we all agreed that we should never let a pandemic go to waste. And so there has never been a time where we've seen infection preventionists on the front news. You know, my family members no longer ask me what I do. They understand what I do. People are using words like PPE in their everyday vocabulary. And so this is a really great time to seize on that and say, look, we are really important, and we need you to help us. And a lot of ways it's funding. I think that people realize that we're, underfunded in a lot of areas, including, supporting the National Healthcare Safety Network, where we report our infections to. There's also been challenges in a decline in vaccinations. And so we've seen, I work in pediatrics, and so we've seen a lot of delays in those well visits where children typically get their vaccines. So we really need to catch them back up due to the shutdowns. There's also been challenges with antimicrobial stewardship. And so we've been, seeing some papers and studies coming out showing that many of these patients who are hospitalized with COVID-19 are receiving antibiotics, and for reasons that aren't just to treat a secondary bacterial infection. And so COVID-19 is a virus, and so we do need to make sure that we're using our antibiotics appropriately. And also healthcare-associated infections. And so there was a recent study that was just published that showed that our CLABC, so that's central line-associated bloodstream infections, as well as our catheter-associated urinary tract infections, have been going up in 2 hospitals that had been comparing their data during COVID-19. And I think that's something we're really, really concerned about. When you focus all of your attention, you have limited resources, and you need to focus all your attention on really responding to a pandemic. That if you're not a well-resourced organization, or even nobody's well-resourced in a pandemic to respond, that you then can't spend as much time as you would like preventing these infections that happen in your hospital. So those are some real important areas that we're concerned about during COVID-19 that we've been talking to our representatives and talking with our public policy committee members about.
So that's great. So again, the message is there are some unintended consequences of obviously a pandemic, and concerns around increases in bloodstream infections, catheter-associated urinary tract infections. We can't take our eyes off of those. There's ongoing concern about antibiotic stewardship during the pandemic. And oh, by the way, folks, we did do an episode, I want to say it's episode 2 or 3. So take a listen so you understand the issues around antibiotic stewardship and how critical that is. But the other thing around COVID-19, and you started to mention this, Sarah, is, APIC and its membership, our president, the staff, we have been advocating for PPE, personal protective equipment. Everybody knows out there that there are shortages of N95 respirators, but gowns, face shields, masks of every kind, not to mention other things that our members use to fight infection. So the issue of advocacy is critical. We need everybody to sort of rally and engage their legislators. Sarah, any thoughts on why people don't do that?
So that's a good question. And I can tell you during my years of doing this work is one of the things that I hear from people is that's just, they feel like they're not qualified. They feel like that this is something I've never done before. It seems scary. I'm not trained. And I think too, as infection preventionists, we kind of quietly go about our work. And so we're not really the ones to say, hey, look at me. And I think that that's something too, that it makes people a little bit reluctant to say, wow, I'm going to speak to this person who's, he's on the TV maybe, or, he's somebody who's very well known in our community. And that makes me a little bit nervous. But what I always love to tell people is, yeah, but you're telling them something they don't know. So they're not an expert in infection prevention. Up until recently, they really didn't even know who we were. But once you spend time with these people, they're very grateful for the work that we do. And especially if you're able to connect with them about a personal story. A lot of us who do this work have experienced, a loved one, a friend, a neighbor who has had a healthcare associated infection. We now have, many of us experienced a loved one, a friend or family member having COVID-19. And so being able to share those stories with our representatives and then use that as a platform to say, and now this is what we need. It really helps them remember who you are and why your work is so important.
So very important to share your story, not just from a work perspective, but to say, I'm a citizen of this community. I have a friend or a family that's been impacted by this infection. What are you going to do about it? Would you say
exactly? And remember, you're their boss. I mean, you vote for them, and so they are there to listen to what you have to say.
Now, in episode 10 of the 5-second rule, we talked about long-term care and how that has been so impacted by COVID-19. And we talked about the importance of advocacy there as well, and helping people understand that our vulnerable populations are at risk, especially in facilities where, again, some of these advocacy efforts around PPE are so critical. So anything else to add around the long-term care and advocacy, Sarah?
Yes, I think that the long-term care facilities have always been an area that APIC and us in public policy have really focused on in wanting to support their infection prevention resources. And so we've long recognized that, the infection preventionists that are staffed in those facilities are often doing multiple jobs. They're not just dedicated to the practice of infection prevention and control. And even prior to COVID-19, nursing homes experienced HAIs and they experienced, death from these infections. And so having an infection preventionist on staff is really critical. But that's really become apparent during COVID-19. And I think we're all very saddened at what we see happening to one of our most vulnerable populations. Over 40% of COVID-19 deaths have been in long-term care patients. And they really need support from infection preventionists, but also, the funds to be able to do that and to train those people appropriately. And one of the things that we were very excited about is CMS had approved, the Centers for Medicaid and Medicare had approved that we would be able to require a part-time infection preventionist on site. And it seems that some of those rules may be loosening. And so that is a great place for people to, stay on top of what's happening and let people know what they want to have happen so we can properly support these long-term care facilities. And so letting your legislators know, hey, we really don't want to loosen those restrictions. We've seen what's happened. We think we need more, not less. And that's going to be critical as we move forward with this pandemic.
Yeah, that's an excellent point. We don't want to, take our foot off the gas, so to speak, on these issues. So, Sarah, we've talked about it. There's so much going on in infection prevention and control, especially now during COVID-19. But APIC makes it so easy. Talk to us a little bit. We've got a lot of different resources and help out there for the infection preventionist who, like you said, is maybe scared, feels intimidated, doesn't know where to begin, but they're the boss. So what is available to make it easy for folks to be advocates?
Yes, I'd love for everybody who's listening to go to the APIC website. There is a whole public policy section. And then underneath the section, there's also an area on the website. If you go to www.apic.org/takeaction, you'll be able to see all of these resources. And one of the things I'd like to highlight is the advocacy toolkit, because this is one of the biggest questions I get from people is how do I start? How do I start to get involved and reach out to people? And the toolkit really walks you through, if you want to write letters, if you want to plan a visit, and it tells you month by month how to go through with planning your visit. And right now, I think you still could do that, and maybe it'll be a virtual visit or a phone call. But the toolkit is been designed by infection preventionists who did this with their state capital, and so it's tried and true. And so I would really encourage people to take a look at that. There's also the action alerts that I had mentioned earlier. So we all get these in our email. And so really open those up, take a few seconds to click on them, send those emails off. And that way we're really strengthening our voice by using all of our members. And then there's also pre-written invitations. And so if you don't know what to say, they've scripted those for you. So APIC has them available for you if you want to send an invitation to your legislator to meet with you or some of your chapter members. And then there's also the action e-list. Oh, I'm sorry, Sylvia, go ahead.
Yeah, Sarah, I want to go back to that action alert, and it is so easy. I don't think I can use, the ICO commercials. It's so easy. A caveman could do it. They're written for you. All you have to do is type your name in and hit send, right?
Yes.
Okay. So that's how easy it is. We do all the writing. It's just type in your name, hit send. And then even if you want an invitation, that's written out, right? It's scripted.
Yes. Everything's been scripted ahead of time for you.
Okay. So there's no excuse.
Right. But you certainly can write your own personalized letter. You don't have to do what APIC does, but you can use it as a template to say what are the important things I want to include in my own, personalized letter as well.
Okay, cool. I just wanted to highlight, guys, this is seriously easy. Okay, so we have the action alerts. We have the advocacy toolkit that has sort of the step-by-step. And by the way, if you're part of a chapter, you all could do this together. And then, Sarah, we mentioned the action e-list. What's included in the action e-list?
So this is what everybody should be signing up to get the latest news. And so I have my action e-list, and I think it comes every Friday. I might have to check that, but I remember it comes very regularly to your inbox, and it gives you the latest news. And so this is sometimes where I see the updates from the CDC that, we all know currently right now are changing frequently. But it's really what's going to be, what's happening now, what's changed recently, And that's what you want to look out for to be able to respond to in real time.
So we've talked a lot about some of the key issues, COVID-19. We've talked about the importance of antimicrobial stewardship, issues around, continued healthcare-associated infections like your bloodstream infections and your catheter-associated UTIs. We've touched a little bit upon the importance of vaccines. And yes, there's a great episode on the 5-second rule about vaccines and the importance of wellness schedules, especially for our pediatric population. So there's a lot going on, and what we really want to do is increase the number of APIC members engaging in advocacy. So earlier I said we had 1,600 members who took action. Let's really try to rally and get at least double that in 2020, if not, get all 16,000 members engaged. Why not? Go big or go home, right, Sarah?
I like that.
So listen, we talked about a lot, but what still bugs you about this advocacy issue in infection prevention and control, Sarah?
I don't know if I can say that it bugs me, but what I really wish people would, understand a little bit better is that we are sharing our expertise. It is a different way and a different audience to share our expertise that may in fact have a bigger impact, both on our practice and for our patient safety. And so when people say to me, I don't know where to start, I can't do that, I've never done anything like that before, I say, push yourself out of your comfort zone, because you may actually cultivate a wonderful relationship with a representative who later down the line has a lot of influence over a law that impacts your patient safety and the work that you do. And so sometimes there isn't, a current pressing issue at your state level, but what you can do by reaching out is cultivate that relationship. And as you build that relationship, they know that they have an expert that they can reach out to, and you may have a huge impact on, legislation that gets written that does impact your work and your safety, your patient safety.
Great point. And listen, if you are a fan of the 5-second rule, and I know you are, and you're not an infection preventionist, let me just alert you to the fact that no matter what you do in life, there's an association out there that represents you, and they do the same thing. They make it easy for you to be an advocate. So again, make sure you get engaged. We have a lot of great information at www.apic.org/take-action. Take action, folks, and remember, infection prevention is everybody's business. I'd like to thank Sarah Smathers from Children's Hospital of Philadelphia for spending time and sharing her expertise in this area.
Thank you for having me.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff, including Silvia Quevedo and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphen.